Welcome to Pain-Free Living. My name is Dr. Andrew Gorecki, physical therapist and owner of Superior Physical Therapy. And on today's show, we're going to be talking about the most common type of back pain, which is called stenosis. You might know it as arthritis. On today's show, we're going to be covering several things. One of them being the common causes of pain when you have stenosis. We're also going to be covering a section where we go over quick tips. I'm actually going to be teaching you things you can do at home to relieve some pain. Later in the show, I'm going to go over a question and answer section where I'm answering common questions that people have from the audience. And then finally, we're going to be talking about some free workshops that we're hosting that we'll invite you to. So stay tuned. We'll be back right after this. Welcome back. My name is Dr. Andrew Gorecki, owner of Superior Physical Therapy, and today we're talking about the most common type of low back pain referred to as stenosis. Stenosis is also known by other names, most commonly arthritis, and the big scary one is degenerative disc disease. So I'm going to talk to you a little bit about what it means. So it's the Latin word for narrowing, and really what it's talking about is a hole on each joint, each segment of the spine. There's a hole where the nerve comes out, and that hole starts to get narrow as we age. It is a very common thing to happen when we age. In fact, there's a recent study that was done that shows that 80% of people over the age of 60 years old have signs of stenosis in their spine, and the tricky thing here is they have no pain in that study. So we'll get back to that later in the show. So stenosis means narrowing. The nerve is coming out, and what I like to describe this as is it's important to recognize that when you look at two bony segments in the spine, the nerve comes out of the hole, but that hole is not a fixed diameter hole. It's actually two half circles. One half circle from the joint or the bone above, and one half circle from the bone below. And so the reason I think that's important is because when people get told they have stenosis, they think that there's nothing you can do about it. And in reality, that hole is narrowing because the bones are getting older, but that hole is also moving all the time when you're moving. So for example, there's three ways we can make that hole smaller just by moving, no matter what age we are. So number one movement that makes the hole smaller is bending backwards. So that will make the hole get smaller. And the reverse on that is bending forward makes the hole bigger. So even if you have stenosis in your spine and you're aging, we know that we can make the hole bigger by simply bending forward. It's why oftentimes people that are older that are having back pain that's related to arthritis, you'll see them walking in the grocery store, leaning on the grocery cart, or having to bend forward because the pain is so bad, or actually just sit down. Sitting down causes the hole to open up as well. There's two other ways we can make the hole smaller. If it's my left side, if I lean to the left, that also makes the hole smaller. Now, if I lean to the right, it makes it bigger, so that's nice. And then finally, if it's my left side, when I turn to the left, that actually makes the hole bigger, open up, and when I turn to the right, it closes it down. So the point is that hole is dynamic. Stenosis does mean narrowing, but it's natural. As we age, our spine is getting older, just like our skin. It's almost as common as wrinkles on the skin. I have a really easy test that I can give you right now that'll help you understand whether or not your back pain is related to stenosis. It's very easy. It's actually 4 questions. If you answer all yes to these 4 questions, there's a 97% chance that you actually have stenosis as the type of back pain. Now, later in the show, we're going to talk about how the type is not the same as the cause. They're totally different. The type is the diagnosis, it's the description, but it's not actually the cause. So we're going to get to that later in the show. So here's the 4 questions. Are you over the age of 50? That's number 1. So do you have 50 birthday candles on your birthday cake? Number 2 is, do you have pain in your back when you're standing? Do you have pain in your back when you're walking is number 3. And then finally, does that pain go away when you sit down? If you answer yes to all 4 of those questions, research and science indicates that there's a 97% chance that that's actually the type of back pain. But the good news is, like I mentioned before, 80% of people that are over the age of 60 years old have been shown to have arthritis in the spine, but they have no pain in one study that I'm referencing. So there's a lot of hope, there's a lot of good news. Stenosis is actually a natural aging process, and there's a lot of things that we're going to talk about today that will help you be able to relieve the pain. Just because you have arthritis in your spine doesn't mean that there's no hope. I'm going to cover all that today. In our next segments coming up, we're going to be talking about the most common cause, the actual cause of pain, which is not the type. So stay tuned. Are you struggling with back pain and sciatica? Are you looking for a natural solution to your pain and you want to avoid medications, injections, and surgery? If so, I have a special event I want to invite you to. It's called the free Low Back Pain and Sciatica Workshop that I'm hosting right here in Traverse City, Michigan. Hi, my name is Dr. Andrew Gorecki, physical therapist and former back pain sufferer. I'm going to teach you the #1 single biggest mistake that low back pain sufferers make that oftentimes leads to surgery. There's only 30 seats available, so call 231-421-9300 to reserve your seat now.
Their techniques were spot on in terms of the technical aspects, and my pain immediately became better managed, and along with that, my performance and my functioning increased.
I'm also going to be giving away to everyone who attends a free copy of my best-selling book, The Truth About Low Back Pain and Sciatica, The Hidden Culprits. So call now. Welcome back. Again, my name is Dr. Andrew Gorecki, owner of Superior Physical Therapy, and I'm going to share with you the most common causes of pain when you have arthritis in your spine or stenosis. And again, to recap, arthritis or stenosis, both the same thing. Also, degenerative disc disease, very commonly called all the same thing. The hole is narrowing, and the symptoms that you're typically experiencing when you have this situation is, again, remember, pain in the lower back when you're standing and walking. Typically will go away when you sit down. But also, we'll have pain in our lower back, but also that pain oftentimes will travel down our leg. And we'll get pain, sometimes even numbness and tingling. That's referred to as sciatica. Stenosis-related back pain can actually create sciatica, which is typically pain traveling down the back of the leg, as well as sometimes numbness and tingling, and even sometimes weakness. Your leg can give out on you, or you can feel muscles that are getting weak. Sometimes your leg will just feel heavy while you're having back pain. So those are the symptoms of stenosis. Let's talk about the common cause. So again, there's a difference between the common cause and the type. We know what the type is. We already talked about the type. But we know that that hole is dynamic. So when you're moving, the hole is either opening up or closing down. So the movements that make the hole close down are actually the key. And there's a really, really common area in the body that causes that hole to close. And it's actually a muscle in the front of the hips, which you can see right here. That muscle is called the hip flexor. The name doesn't really matter, but where it's at is really important. So you can see that it sits in the front of the hip, but it actually comes from the spine. So you see how it's attached to the last 5 segments of the spine. That's the lower back. And then it goes all the way down and it wraps to the inside of the hip. So right now when you're watching this show, you're watching me, you're sitting there, and that muscle is totally relaxed because you're in the sitting position. And it's doing nothing. When you go to stand up, however, that muscle gets tension. And when the muscle has tension, it starts to pull on the spine. It pulls the spine forward. And if that muscle's tight, because we've sat too much, which is really common, by the way, we sit so much these days. I think the average was 10 hours a day the last time I looked at a study on that topic. That muscle starts to get really, really short and it loses flexibility. When you stand up, that muscle pulls the spine forward. Pulling the spine forward is the same thing as the spine bending backwards. And if you can remember earlier in the segment, we talked about how bending backwards actually closes down that hole. It's also why when you're standing, that's one of the #1 questions we ask. Do you have pain when you're standing, and does it go away when you sit down? If you answered yes, there's a good chance you have stenosis. So that muscle can become a big problem. And now, not to mention, when you take a step forward, and you have one leg behind you, that muscle really has to lengthen. It has to maximally lengthen in order for you to take a step forward and then the next foot goes forward. That really starts to pull on the spine, even more than just standing. So again, that's why #2 question was, do you have back pain when you're standing and walking? And if so, we know that that muscle is the most common cause. So very interesting when you think about the cause being different than the type. People that are living with arthritis in their back, remember 80% of people over the age of 60 don't have pain, but they have it. The reason that they're able to live without pain is because they have good mobility in this muscle. This muscle doesn't have tightness. They're able to stand, they're able to walk, and that muscle doesn't pull on the spine and it doesn't cause the hole to close down, so they're able to live pain-free. So in the next segment, what I'm going to cover is a quick tip that shows you an easy strategy that you can do in your own home. No equipment needed. Just do it once a day. That will be so easy, it will give you flexibility in that muscle and take away the pain that's related to having tightness in that area, so that the hole in your spine can stay open, the nerve can be happy, you can eliminate the pain that's traveling down your leg, no longer having sciatica, and you can live pain-free, which is what it's all about. So stay tuned, we'll be right back. Are you struggling with back pain and sciatica? Are you looking for a natural solution to your pain and you want to avoid medications, injections, and surgery? If so, I have a special event I want to invite you to. It's the free low back pain and sciatica workshop I'm hosting right here in Traverse City, Michigan. Hi, my name is Dr. Andrew Grecki, physical therapist and former back pain sufferer. I'm going to teach you the #1 single biggest mistake that low back pain sufferers make that oftentimes leads to surgery. There's only 30 seats available, so call now. All right, everybody, welcome back. Again, my name is Dr. Andrew Grecki, owner of Superior Physical Therapy, and here we are in the clinic today. I'm going to teach you a couple quick tips on how to relieve back pain specifically for arthritis or stenosis-related back pain. Okay, so this quick tip is going to be a strategy on how to relieve the symptom of pain quickly. It doesn't treat the problem long term, but it relieves the symptom of pain quickly. Remember earlier in the segment we talked about when you have stenosis in your spine or arthritis, the hole starts to become, the diameter of the hole becomes smaller because we're aging. But also remember, as we move, the hole can open or close. So a way to relieve pain quickly is to open up the hole. So I'm going to go ahead and grab a chair. Any chair will be fine. I'm going to sit on the front edge of that chair and simply flex forward, which is going to open up the hole. So a really neat strategy to decompress the nerve. So feet are shoulder width apart. We're going to gently reach down towards the ground. There is no requirement for how far you go. We just want to gently reach back and forth for about 45 seconds. If it feels better just to hold it, you can hold it as well. So 45 seconds, 2 or 3 times, maybe even 2 or 3 times a day, and you should start to notice some relief of the pain. I love to look at studies. Studies give us all kinds of information that helps us make better decisions as physical therapists to help you live pain-free. So today we're talking about a study called the asymptomatic imaging study. So what that means is this study took thousands of people that have no pain. And what they did is they gave them an MRI and an X-ray. And they wanted to find out what's going on in the spine, particularly the lower spine. And the results are absolutely fascinating. So you've got a lot of people that are out there, they're not having any pain, they get the MRI or the X-ray, and what they found was the majority of people that are living without pain have stenosis or arthritis or degenerative disc disease, which is again all the same thing, they're just called different names. It's aging of the spine. The majority of people that are walking around on earth have this in their spine. In fact, you can see the table here. Here's our numbers. You're focusing on the top column here, which is the disc degeneration, which again is arthritis. We know that 80% of people over the age of 60 are walking around with this in their spine without any pain. If you go to the 80s and 90s, we're talking about 97, 98% of people that are in their senior years are dealing with arthritis in their spine, yet they have no pain in the study. And so that's fascinating if you think about one of the main indicators that people will end up having surgery in their spine because they have back pain is what the image says, right? So now you have to think to yourself, gosh, that can't be the only decision maker because there are so many people, the majority of people are actually living without pain, yet they have this in their spine. So very fascinating study, and I hope that that makes sense to you and that you can digest that information and recognize that there's a lot of hope. If you're out there and you've got back pain and it hurts when you stand and you walk and you have to lean on the grocery cart when you're shopping and it goes away when you sit down, again, we know that there's a good chance that you have arthritis, but hopefully this study sheds light on the fact that there is a lot of hope for you. There is a lot of things you can do, and in the next segment, I'm actually going to be covering some quick tips and showing you some strategies on how you can relieve pain naturally and avoid medications, injections, and surgery, which is what I'm all about, is helping you heal naturally. And for our next tip, I'm going to show you how to reduce the movements that are causing the hole to close down. If you can remember earlier in the show, we talked about the muscle that lies in the front of the spine, and it actually attaches to the hip. And right now that muscle's totally relaxed. It's called the hip flexor, by the way, if you remember. But when you stand up, that muscle gets tension, and when you take a step forward, that muscle gets even more tension, and it pulls the spine into an extended position, which closes down the hole. So I'm going to teach you how to gain some flexibility in that muscle. So real easy, we're going to take that same chair that we were just using. Now, you can use a stairway or a chair. We just need something to get your foot up on. So here I am, I'm going to take one foot, I'm going to put it up on the chair. Right away I notice I need a little bit of stability to hold on to. So by all means, if you're at home and you're trying this, I want you to have your hands on a table or a wall or another chair. You have to make sure you're safe, number one. Number two here, we've got the distance is like a big step forward, okay? Stairway works really good. This back leg is nice and straight. The foot is also straight. And we're going to gently take our body and move our pelvis forward. Right away, I start to feel tension right in the front of this hip. Well, guess what? That's the hip flexor. That's the muscle that's pulling your spine when you're having pain in your back from standing and walking. This is a natural way to relieve that tension. So we're going to try 30 seconds moving our hips front to back. Then we're going to move our hips a little side to side, 30 seconds. And then the last one is my favorite. We're going to go around in little circles. Of course, I'm going to do this on both sides. It takes about 1.5 minutes each side. And if you do this one 2 or 3 times a day, you're going to notice that walking starts to become less painful in your back. You're going to get relief of that sciatic pain naturally without medications, injections, and surgery, which is the name of the game. Are you struggling with back pain and sciatica? Are you looking for a natural solution to your pain and you want to avoid medications, injections, and surgery? If so, I have a special event I want to invite you to. It's the free low back pain and sciatica workshop I'm hosting right here in Traverse City, Michigan. Hi, my name is Dr. Andrew Grecki, physical therapist and former back pain sufferer. I'm going to teach you the #1 single biggest mistake that low back pain sufferers make that oftentimes leads to surgery. There's only 30 seats available, so call now. I want to cover with you two easy actually self-tests that you can do in the safety of your own home that'll help you understand whether or not this might be something that's causing your back pain. Again, remember, a lot of people are living with this, and so I think it's important for you to be able to take control of your health and understand whether or not you have it or not. So just to review, the first self-test is actually what's called the clinical predictor rule, which is the 4 questions that I told you earlier. So those 4 questions to review are you over the age of 50? Do you have pain with standing? Do you have pain in your lower back with walking? And does that pain go away when you sit down? If you answered yes to all 4 of those questions, research shows there's a 97% chance that you have stenosis or arthritis in your spine, and that is the type of back pain you're dealing with. Remember, the type is different than the cause. Now, the second test is more of a movement-related test. Very easy to do, and maybe a disclaimer is this movement is a test that if positive, it's because it hurts. So you can try these movements, but beware at home. You don't want to hurt yourself. I'm just going to demonstrate, and you need to be careful when you're doing this at home. So we know that there was 3 ways to make the hole smaller, as I mentioned earlier. And you go through those 3 movements. So the first movement was bending backwards. So you take your shoulders and your upper body and you bend backwards. If that hurts, that's a sign that you have a problem with the hole closing down. Hurting in the back or traveling down the leg. If you have pain down your leg when you do that as well, that's also a positive sign. Okay, the second motion is bending to the side. So if I have left-sided back pain, if I bend to the left, that closes the hole down. Again, that's another indicator there's a chance you have the hole narrowing and there's stenosis or arthritis. And the third one is when you turn your body to the right. So if I turn my arm and my shoulders to the right and that hurts my left side, again, that's another indicator. Now, the real test is actually combining all 3 of those at the same time. It's called a quadrant test. And so what we do there, if I'm testing my left side, I'm going to lean back, I'm going to also lean to the left, and then at the same time I'm going to turn to the right. Kind of looks like a backswing for a golfer. If I have pain on my left side, very strong indicator that stenosis is part of the problem. Now, I can test the right side by doing the exact same thing. I can lean back, I can lean to the right, and I can also turn to the left. Again, that closes down the right side and makes the hole smaller. If I have any back pain or sciatic pain, remember, sciatic pain is the pain that travels down the back of your leg, where there's numbness, tingling, and even sometimes feeling like the leg is getting weak. Those are all symptoms that would indicate a positive quadrant test. So there's two easy, really easy tests that you can do that I typically start with when I meet somebody in the clinic. And I'm always trying to meet somebody and very quickly help them understand whether or not we can help them heal naturally without medications, without injections, and without surgery. That's the name of the game if you want to return to pain-free living. That's my expertise. And coming up, I'm going to be addressing some of the most common questions that I get, and I'm going to give you the answers. Welcome back. My name is Dr. Andrew Grecki, physical therapist and owner of Superior Physical Therapy, and I'm going to answer one of the most common questions that I get from people that are dealing with back pain, specifically those people that are dealing with back pain that have arthritis or stenosis. And it's a really simple question, which is, how long should I wait before I get help for my back pain? And I think a lot of us are used to being younger, and when we were younger, we would have pain, and we'd hurt ourselves, maybe we had a little injury here and there, and we would heal pretty quickly. In fact, my 4-year-old, he'll heal so fast, it's unbelievable. So I think we got used to that for maybe 20 to 25 years, and as we get older, it becomes harder or slower for our body to repair itself. And so I see people in the clinic as a physical therapist very commonly will tell me they've had back pain for months, for years, even 10, 15, 20 years. And I always ask them and they ask me, well, when should I have come in and seen you? And I always kind of say, gosh, there is really actually a pretty scientific answer when it comes to that question. And it's really based on the science of healing. And so we're gonna go over that today right now, which is, how long should I wait before I get help? And really the simple answer is actually somewhere around 4 to 6 weeks. And let me explain why I say 4 to 6 weeks. So you can see here, we're going to talk about the 4 phases of healing. I have an image here that you can see there's actually 4 phases to the healing process. And this is the same whether it's a cut on your skin or a tissue damage inside of your body, whether it's the nerve being compressed, in this case from the hole closing down, that actually damages the nerve and actually damages the joint and causes tissue damage, which phase 1 of the healing process here you can see is called hemostasis. That takes about 1 to 3 days. Phase 2, however, is called the inflammation phase. That lasts from about 3 days to 20 days. And so that's interesting when you think about inflammation, because a lot of times we're actually treating inflammation in order to relieve our pain. Maybe it isn't the best idea. In fact, there's studies now that show that treating inflammation only actually delays the healing process. Things that would help us treat inflammation might be like ibuprofen or aspirin. Injections in the spine will oftentimes treat the inflammation that's occurring. And yet it's the second phase of healing, and it lasts between 3 and 20 days depending on how much damage there is to the tissues inside of our body. And you can see that we've got the phase 3, which is granulation, and phase 4 here, which is maturation, which can take a minimum of 6 weeks and can last up to 2 years. So you can see here that in the 4 phases of healing, the minimum amount of time is around 6 weeks. So if you're struggling with pain in your back, or you, again, have that sciatic pain that travels down the back of your leg, oftentimes that's going to be pain, numbness, and tingling, sometimes even weakness. There's a really good chance that in the next 4 to 6 weeks it's going to go away on its own if the thing that was causing it in the first place, the thing that was causing the hole to close down and the damage that's occurring is not there anymore. That's really the trick. If we're only treating inflammation, it will delay the healing process. And if you're trying to wait it out and let your body heal on its own, you should really be thinking about somewhere between 4 to 6 weeks. If it's not getting better, you should consider seeing somebody that's going to be able to address the movement-related pain. That's the key. So physical therapists are the movement experts. We're going to help you identify the movements that are closing the hole down. We're not just going to mask the symptom of pain by treating inflammation. We need to address the thing that's causing the hole to close down. In fact, not only that, but we also need to teach you how to open up the hole so you can get pain relief. Another popular question I get is, should I get an MRI for my back pain? And that's a really, really common one. I think almost every patient that I meet with back pain wants that MRI. And if you can remember earlier, we were talking about that study, the study of the week that shows when they gave all these thousands of people an MRI and without pain, they had no pain, so just random people without pain, 80% of people over the age of 60 have stenosis in their spine on the MRI, but they have no pain. So the answer to that typically for me is, I think getting an MRI makes it harder for people like me or the doctor to help you with your back pain, because it makes us think that that's the reason you're having back pain, because you have this aging and the hole is closing down. And when in reality, we know that the type of back pain usually isn't the cause of back pain. So I think oftentimes it leads people down a path of unwanted, maybe unnecessary medications, injections, and surgery because they got that MRI. Now there are some situations when you should get an MRI. And so those are called red flag scenarios. So one red flag is if you have any changes in your bowel or bladder function. So you have back pain, you have sciatic pain because of stenosis, maybe, and you have changes in your bowel or bladder function. That's like an emergency situation where you should talk to a doctor, maybe even the emergency room, and you need to have an MRI to find out what's going on. A second one is if you start to get foot drop. So if you get foot drop in your foot and you have back pain and it travels down the back of your leg, that's also an MRI situation. And then there's really two other situations. If the doctor suspects that you have an infection or that there's a fracture. So if you have an injury where you fell and somebody thinks you have a fracture, again, that image is really important. Otherwise, for people suffering with back pain and sciatica, without those red flags, there's really no good reason why you should have an MRI. You should think of an MRI as a pre-surgical tool. So if surgery is warranted, if you think you're going to have surgery, which I would highly recommend you don't, trying other things, naturally healing, then I would try to avoid having the MRI as much as you can unless you have those red flag symptoms. Are you struggling with back pain and sciatica? Are you looking for a natural solution to your pain and you want to avoid medications, injections, and surgery? If so, I have a special event I want to invite you to. It's called the free Low Back Pain and Sciatica Workshop that I'm hosting right here in Traverse City, Michigan. Hi, my name is Dr. Andrew Gorecki, physical therapist and former back pain sufferer. I'm going to teach you the number one single biggest mistake that low back pain sufferers make that oftentimes leads to surgery. There's only 30 seats available, so call 231-421-9300 to reserve your seat now.
Their techniques were spot on in terms of the technical aspects, and my pain immediately became better managed, and along with that, my performance and my functioning increased.
I'm also going to be giving away to everyone who attends a free copy of my best-selling book, The Truth About Low Back Pain and Sciatica, The Hidden Culprits. So call now. Just to summarize what we talked about today in our show here, we were hitting on the most common type of back pain, which is stenosis. That also is the same thing as arthritis, degenerative disc disease. And really what we're talking about there is the hole's narrowing. So that hole is moving all the time. So there's a lot of hope for you guys out there suffering with that back pain or maybe even that sciatic pain that travels down your leg, the numbness and tingling, maybe the weakness. We also talked about the most common cause, which is actually coming from the hip. We've got a nasty little hip muscle in there that gets tight from sitting too much. We also talked about some self-tests that you can do on your own to help understand whether or not you have stenosis-related back pain or not. Hopefully you enjoyed me answering the two most common questions that I get almost on a daily basis when I'm working with people in back pain. And hopefully you also enjoyed the quick tip that I showed you and you're able to try that on your own and hopefully find some relief. So if you're out there suffering with back pain and today's show made you realize it's probably stenosis related or arthritis, give us a call. We have several low back pain specialists here at Superior Physical Therapy. There's no reason that you should have to suffer with your back pain, especially if it's been going on more than 4 to 6 weeks, as we talked about earlier in the segment. So give us a call now or come to one of our free workshops where you can learn even more about back pain and find natural solutions so you can heal without medications, injections, and surgery. I'm Dr. Andrew Gurecki, and let's get you back to pain-free living.